Important story this morning. A just-released Gallup survey finds a growing number of college students have considered stopping out or withdrawing for a period of time, not dropping out, but stopping out. More than 40% of all students say that they've considered it in the past 6 months. The main reason, emotional stress and personal mental health. They now far outweigh things like financial or academic issues. So joining us now to break this all down is Dr. Rebecca Berry. She's a clinical psychologist and child and adolescent psychiatry professor at NYU. Good morning. Thank you very much. I wanted to ask you the big takeaways here, but if I can jump ahead a little bit. Sure. Does this have anything to do with COVID and how it's changed us and people? We haven't quite figured out how much mental issues and other things that we're dealing with after COVID?
I think that that's going to be a part of it.
Part of it.
You know, we've seen a growing trend with college students in general, with a rise in depression, anxiety, and suicidal ideation, really within the past decade. And then we have the period of COVID, which we know that can, for many individuals, have exacerbated those conditions. And so I think what we're seeing here is that college students are considering, right, they're more aware of what's happening within themselves and this emotional distress, and they now are considering an option. What do I do now when I have this emotional distress? And they're saying that stopping out is one of those options. So I think that what this poll is suggesting is that it's not necessarily tied to COVID. It could be part of this overall trend that we've been seeing really within the past decade or so.
I was struck by it's a lot more women than men in this study that are. What, do you know why?
Well, I think generally the trends for reporting of emotional distress really do vary by gender. We tend to see that women, due to societal norms and just the way that we are sometimes programmed to, talk about our feelings, or that it's expected more so sometimes than the types of roles that are put on men to disclose of their feelings and talk about them.
Yeah.
I do think also younger students are way more willing to talk about this than people were previously. And like you said, not just talk about it, but also they're willing to say, okay, I'm actually going to not take the conventional route and do something different.
Right.
My brother is a freshman on a college campus right now. And one thing that I think about even when I was there is the resources on a college campus. It's not that this is not something schools are unaware of, but are they equipped to be able to deal with it and not just say, okay, here's a counselor, but like to actually really address the issue.
I think you make two really excellent points there. I think young people in this generation, this age gap between 18 and 24, are more willing to talk about what they're going through. I think that social media can play a role in that as well. And then there's this issue of whether or not the resources on campus have availability. Can students access those available resources? And I think that many college campuses are doing a great job at trying to serve the needs of their student populations. And yet with this growing trend that we're seeing more and more students become aware of their feelings, become aware of the need to get services, and there just aren't as many. These counseling centers aren't equipped to really serve that type of load.
Yeah, that's a good question. It's not just a matter. When I was in college, just go to the infirmary for everything, right? It wasn't specific. Yeah, that's what they call it.
That's what they called it?
Yeah, they called it. Just go to the infirmary. So listen, looking into this study, according to it, race and ethnicity play a factor in students expressing these kinds of concerns. What does it show?
So I think similarly, as I was mentioning to Poppy, it shows that there was in this poll, a higher likelihood of non-Hispanic or Caucasian individuals to report on their emotional distress. And we saw lower numbers within the Hispanic or the Black communities to do so. And I think that really speaks to the cultural trends just generally with regard to, trust in being able to report these things and trust in accessing.
Being believed and heard.
Absolutely.
Dr. Rebecca, thank you. I mean, it's such an interesting look and so important with how many students are on college campuses.
We know it's early. Will you come back?
Oh, I will come back.
We'd love to have you back. This is great.
Really
we learned a lot.
Show.
Love having you at the table.
Thank you.